Sponsored by RxCardClub.com. Get a free prescription drug card and save up to 85% on prescription drugs. RxCardClub.com. What's the maximum dose of propranolol? The maximum dosage for propranolol depends on which dosage and form of the drug is prescribed and what condition is being treated. For high blood pressure, the usual maintenance dosage of propranolol tablets, solution or extended-release capsules is 120 mg to 240 mg per day. However, a dosage of up to 640 mg a day may be prescribed for some patients. For chest pain, angina pectoris, the maximum dose for propranolol is 320 mg per day. If you have had a heart attack, the maximum recommended dose for propranolol is 240 mg per day. If your heart muscles are diagnosed as abnormally thick, hypertrophic subaortic stenosis, the recommended dose range is 20 mg to 40 mg propranolol taken 3 or 4 times per day. For essential tremor, the maximum dose for propranolol tablets and solution is 320 mg per day. For pheochromocytoma, 60 mg is the maximum dose for propranolol tablets and solution. Propranolol extended-release capsules are not indicated for the uses of essential tremor and pheochromocytoma. For atrial fibrillation, the recommended dosage is 10 mg to 30 mg propranolol taken 3 or 4 times daily before meals and at bedtime. When treating migraines, the initial dosage is 80 mg propranolol daily in divided doses. The typical effective dose range is from 160 mg to 240 mg per day. Propranolol may also be used to treat a condition known as essential tremor. In this case, the initial dosage is 40 mg twice daily. A typical maintenance dose may range from 120 mg to 320 mg daily. The typical dosage of propranolol for pheochromocytoma is 60 mg daily in divided doses, prior to surgery to remove the tumor. If surgery cannot be performed, the typical dosage is 30 mg daily in divided doses. RxCardClub.com. Get a free prescription drug card and save up to 80% on prescription drugs.